Hi, my name is Rebecca, and I'm here to tell you a little bit about Ehlers-Danlos Syndrome, and specifically how it's affecting my jaw and my nose, and what we're going to have done about it. As a lot of people in my life and outside of my life know, I have a connective tissue disorder called Ehlers-Danlos Syndrome, or EDS. It affects all of my joints and all of my soft tissue, and it causes a multitude of problems from head to toe. It's affects every bodily system. It's not just joints, it's not just bones. It's affects the musculoskeletal system, the digestive system, the cardiovascular system, a little bit of everything. But in this video I want to talk about the next surgery that I'm going to be having, which is here. And it's not a place that a lot of people think would be affected by EDS, but it is. So when most people hear about EDS, they think it just makes you flexible, which is true. Hypermobility is a big part of it. As you can see, this is one of my party tricks. My fingers do go all the way back, which kind of freaks people out a little bit, I guess. My knees, my elbows do that as well. But because I have that flexibility, it also means my joints and my tissue are also very flexible, and that's what causes the problems. So it's genetic. This is an issue I've had all my life. It is progressive. It's getting worse as I get older. And that's what's happening with my jaw. Now, I've had a slight overbite most of my life, since I was about 10 years old. But in the past probably 10 years, it has gotten much worse. It is now the worst that an overbite can actually be. It's the biggest that an overbite can get. And it's made my chin recede, because what's happening is my lower jaw is kind of disintegrating and going inwards. And you can see from my profile, you can see the overbite a lot worse. See, it's here, and then, yeah, no. Not very attractive, right? So that's a problem. The other problem is, not only is my jaw, going back, do I have this overbite, but my jaw is shifting to the side. So when I clench my teeth, you can see one side of my mouth, my teeth don't actually touch, my top teeth don't touch the bottom ones like they're supposed to. Which is an issue too, for a lot of different reasons. It's actually, the shifting has made my nose even more crooked. I'm already losing cartilage in it, but it's making my whole mouth look a little sideways, which is weird. So of course there's a cosmetic issue here. The overbite is not attractive. The lack of chin is not attractive. That's not why I'm getting it fixed, though it's for medical reasons. The only way to actually fix this is to have both of my jaws broken and wired, and one brought forward and then one brought kind of back a little bit, which sounds like a horrendous surgery, and I've put it off for years and years, but now I can't put it off any longer. It causes a tremendous amount of pain right in here. I wake up with headaches every day. Sometimes they last all day. You can actually feel on this side the fact that the jaw clicks nonstop. I have to watch what I eat, because if I chew anything hard, my jaw will lock into place. Sometimes it'll stay that way for a day. Because of the nose issue and what my jaw dislocation has done to my nose, I can't breathe out of my nose anymore. I can only breathe out of my mouth. It's caused issues with my teeth. In the past 2 months, I've had severe periodontal disease. I've had to have 2 teeth pulled. I'm going to have 2 more pulled next week. And it'll just keep happening and keep happening. They're cracking, they're crumbling. Dental issues are prevalent in EDS. We don't normally get root canals or anything invasive, because they either don't work or the Novocaine actually doesn't work on us. Sometimes it's just better to have them pulled, and I will eventually have to have a full set of dentures, top and bottom, but before I can do that, I have to get the jaw fixed. It's you wouldn't think that the jaw would cause that much problems, but it does. It's chronic sinus infections, which I stay on sinus treatment, and you can even hear right now, I sound really congested. I constantly have drainage, so I always have a sore throat. I get the sinus headaches as well as the pain and the headaches caused by the jaw. And all of this is EDS related, and that's just one of the many problems that EDS causes. I have a Chiari malformation, which basically meant my brain was hanging out into my neck. I had to have brain surgery for that. So this is the second surgery that EDS is making me have in my head. The third one will be for my cranial-cervical instability, which is where I'll have a fusion from my skull to the top of my backbone, my spine there. That is a little bit on down the road. But this is hopefully an explanation of just one thing that a lot of us with EDS goes through, and will explain a little bit why I'm having the jaw surgery and what I hope to accomplish with it. So thank you. If you have any questions that are EDS related, please feel free to send me a message, and I'll try to walk you through them. Thank you.